As far as healthcare, though, there's a lot of other things we can do. Of course, everyone should have universal healthcare, but until that happens, there's a lot of stuff we can do. We can build out publicly funded health centers located mostly near hospitals. A lot of uninsured currently go to emergency rooms for their healthcare. The treatment is about 10 times as expensive as going to a healthcare center. America has twice the obesity rates of the rest of the world, high blood pressure, type 2 diabetes, a million different issues, you know. Working with chiropractors, my mom has done a little bit of that, she had some problems. There's so much you can do just with proper nutrition and lifestyle change. We're canvassing Dr. LeRoy, he's one of my neighbors. I actually think he's a Republican, but I think I can convince him. How you doing?
Good.
We're all set. How's it going?
Doing good.
So you've seen my material before, right?
Yes.
So, you know, a big part of some of my campaign stuff is like healthy lifestyle and stuff like this to keep down health insurance and make people take more responsibility of their lives. How do you feel about, you know, nutrition and diet and exercise?
I do a lot of work with that in my practice. Diet, a lot of nutrition. Diabetes and obesity account for about 30% of healthcare expenditures here in the United States. And I think people should have some degree of accountability in making lifestyle changes and changing their diet.
And we can start with children. Just for an example, Chicago started a free breakfast program for kids last year, but the fact is they serve donuts and sweet cereals and stuff like that. And it's kind of silly, you know. How do you feel? How do we get people to change?
Well, it's education, and it starts with children. So I think you hit it right on the head with the breakfast program that they're doing here in the Chicago Public Schools. They're not serving them the right sorts of foods, and they're reinforcing eating the wrong types of foods. I had a 6-year-old patient who came in from the public school system. She weighed 130 pounds, and she informed me that she was eating Captain Crunch for breakfast at one of these programs.
The United States has twice the rates of obesity of Europe. These costs amount to over $100 billion a year. Many of these problems can be helped just by, you know, common sense exercise and diet. What you see is, you know, large corporations like McDonald's and chains with a lot of processed, sugary, fatty foods are now even flowing into our school systems, where Chicago has a free breakfast program that started last year, and the choices include sugary donuts and cereals. These are things that our children are going to be learning these habits for the rest of their lives. Just maybe have more incentives for healthier people where your insurance rates are less. I mean, there's a reason why insurance rates are high, because we have a lot of sick people in the country. I went running today in a snowstorm, and I don't expect everyone to do that. And it's a great question. How do you change someone's lifestyle and bring down healthcare costs? Because you don't want the state to get involved in telling someone what to do with their personal life. But I think there's a lot you can do. The state and the city can have more events for, you know, cycling, biking, running events, more stuff about nutrition, awareness programs. We need a certain bit more personal responsibility, and I believe this ties in with our financial problems as well.